Welcome back to Diabetic Foot Files. I'm your host, Dr. G. I should start calling this Diabetic Foot Files at night because I've been on this roll of doing it at midnight. So today's episode is not about the foot, it's about something far more devastating to lose. Because in medicine, especially in diabetic limb salvage, we talk about amputations all the time. We measure it, we document it, and we fight to prevent it. But there's another type of amputation, one that doesn't show up on x rays, one that doesn't bleed, and one that has no surgical team that it can reverse. And that is the amputation of the human spirit. So me as an old school person, like my daddy's super old school, so he brought me up on all the good old oldies. There's a powerful scene moment in the movie with Al Pacino, the movie called Sense of a Woman. If anybody knows it, you know it, right? And it stars Al Pacino as Lieutenant Colonel Frank Slade, right? And he's blind. He's blind. He's a bitter man. He's brutally honest, which I love, who has lost his physical independence, but he has not lost his awareness of the world. And one of the most iconic scenes in this movie, Scent of a Woman, he stands before the disciplinary committee defending a young student who being pressured to betray his integrity. And Colonel Frank Slade says something that hits deeper than any diagnosis. He talks about a different kind of damage, not the loss of sight, not the loss of a limb, but the moment when a person chooses the easy path over the right path. He calls it an amputated spirit. And what he means is a person can still walk and still talk and function, but if they compromise who they are, if they sell out their values, their courage, and their truth, then something essentially has been cut away permanently. And in that speech, Colonel Slade makes it clear he's seen real injury. But what terrifies him more than blindness is watching someone choose to lose their integrity. Because unlike a limb, that kind of loss is invisible, normalized, and often irreversible. But that's where this ties back to us. Because in diabetic foot care, we fight to save limbs every day. But what happens when the system, the clinician, or even the patient starts to cut corners? What happens when we ignore early signs or dismiss pain or accept preventable decline? What happens when we stop fighting as hard as we should? I know everybody's talking about physician burnout. That's not just clinical failure. That's the beginning of something deeper, something more dangerous. That's the beginning of an amputated spirit. So today we're going to talk beyond tissue, beyond ulcers, beyond protocol. We're going to talk about the integrity in medicine, the courage in clinical decisions, the invisible line between what's easy and what is right. You got to do what's right over what is easy because saving a limb is important, but preserving the spirit behind the care, that's everything. So let's get into it. So, like I said, in that moment in the movie Sense of a Woman, that every clinician should understand, Al Pacino, Colonel Slade, right? A man who has lost his sight but not his clarity is sitting at the multidisciplinary hearing, right? Well, disciplinary. I keep wanting to say disciplinary. And this young student was pressured to betray his classmates, to take the easy path, to protect himself, and to survive the system. And Colonel Slade, aka Al Pacino, interrupts, not gently, not even politely, but with the kind of truth that cuts deeper than a scalpel. He says he's seen boys with arms torn off, legs blown off, but there's nothing compares to what he's witnessing in that room because what's happening there is a slow, quiet mutilation, not of the body, but of the soul. And he calls it an amputated spirit. So, what is an amputated spirit? What does this actually mean? An amputated spirit is not about the loss of ability. It's about the loss of integrity. And it seems like this is a huge fight that is going on between clinicians and the healthcare system right now. This loss of integrity. And it's when a clinician knows what should be done but doesn't do it, a system that prioritizes convenience over the patient's outcome, a patient gives up before the fight is over, and a flag that is seen but ignored. So it's when your internal compass, the thing that tells you that this is wrong, gets silenced. Not because it disappeared and not because it's overridden. It's because here's the dangerous part. You can still function with an amputated spirit because you can still chart, you can still prescribe, you can still operate, but something essentially is gone, which is that integrity. And you don't want to lose that, especially with this burnout that's going on. So, how does this show up in diabetic foot care? So, let's bring it back to our world. Because in diabetic limb salvage, we're not just talking or we're not just even seeing physical amputations, we're seeing spiritual ones. I keep on telling people wound healing is quite spiritual. So let's say, a patient presents early, small lesion, superficial, completely salvageable, right? But then the clinician says, let's just watch it. The patient doesn't get offloaded. There's no aggressive intervention like vascular referrals. There's no urgency. And weeks pass by and it worsens, infection sets in, and it's complicated. But the truth is, the complication didn't start in the wound, it started in the decision. And that was the first cut. So, also, let's say the patient needs vascular intervention, right? Like, let's talk about system failure. So, there's clear ischemia, there's delayed healing, but the insurance delays the approval. Appointments get pushed back, referrals take time, like weeks. Everyone knows what needs to happen, but no one moves fast enough. And the limb doesn't fall overnight. It fails slowly when the system stands still. And that's not inefficiency, that's also another systemic spirit amputation. And on a side note with that, like I said, you got to move fast when it comes to diabetic limb salvage. You can't just wait. You can't just wait these weeks with referrals. One thing I can do, I can nag, I can get it done, okay? Like, nag, like, "Have you seen this patient? Have you seen this patient? Have you seen this patient?" You know? Now, another thing that's going on, like, so right now, social media, like TikTok, they have all these different fruits that are different physicians in their different specialty, and they're talking about their burnouts and, not liking what they're doing right now. And it's kind of sad. It's very discouraging to hear because I mean, you wanna do what you love, right? Because if you do what you love, you never work a day in your life, you know? And just here are these people being very discouraged, burnt out. It causes a desensitized clinician. We've seen too many cases of this, like, let's say the physician seen so many ulcers, so many amputations, and, something shifts. Something that used to feel urgent feels routine now. A toe amputation becomes, "Oh, it's not that bad," or a transmetatarsal amputation becomes, "Oh, that's a decent outcome." But the normalization of this is quite dangerous because when you stop feeling the weight of the loss of these patients' limbs, you stop fighting it the same way, and, the spirit starts to go. The spirit of fight, the spirit of limb salvage starts to go, We shouldn't normalize that. Now, another thing that happens a lot with patients is patients can give up, but I can promise you this. This is what only from my own experience. The patients that I have that wanted to save their limb, they have the strongest willpower I've ever seen. Okay? The patients that if they find out that they have an option to save their limb, I from my experience, I promise they will do what is need to be done. They will walk to their appointment if they have to, even though they shouldn't. They just want to save their limb. Like I don't think people can really wrap their head around it unless it's actually them, knowing that, hey, doctor is telling you that they have to cut off a part of your body. This isn't like a toenail clipping where it grows back. They have to cut off a part of your body, and that is a part of their identity that is going to be pretty much compromised, and they don't know what else to do. But you have to remember the pain. You have to give them all their options, and there are some options where they can. Okay, if it's actually salvageable, try try to save the limb. That's why it's called limb salvage. Okay, but it has to be for in the patient's best interest, though. We're not going to just save it and then it causes the patient to have a low quality care of life and such etc. But the whole point is to give the patients all the options, even though it might be the hardest route. Limb salvage is quite hard. Limb salvage is tedious. Limb salvage is a marathon. I don't think limb salvage is people for people who have low endurance. I'm talking about clinician wise. If you have low endurance, it's not for you because, or impatience, it's not for you because you have to keep going. You just can't stop. That's limb salvage. That's diabetic limb salvage. You just don't stop. Once you start, you just don't stop. That's it. Just don't stop. That's it. Might not even be an end. Just don't stop. But, I I rarely see my patients give up. Okay? Rarely. Okay? Sometimes they get misinformed, but if they know and they stick with it, they're usually happy, okay? But that is one of the hardest things because a lot of them, like I said, they are traumatized from previous experiences, especially if they've had amputations before because, patients have been through multiple ulcers. They have had different even clinicians and had some bad experiences, some good experiences, pain, frustration, exhaustion, and they say, just take it. They'll say, just take it, and it's not because it's medically necessary in that moment, but it's like mentally they're just done. Okay. And that spirit has been amputated even before the limb has. Okay. So let's compare. So, physical amputations, they're visible, measurable, documented, and treated. But spiritual amputation, right? And we're just talking philosophy right now, okay? Is invisible, gradual, rationalized, and ignored, okay? And one thing happens in the OR, the other thing happens in decisions, like in silence, in hesitation, in compromise. And here's the truth you can lose a limb, but you could still have your spirit intact. Like I told you, these patients want to keep their limbs. They want to have hope. They want to know that the quality of their life is better. They want to know that you care. They want to know that you know what you're talking about. They want to know that, hey, and honestly, I feel like a lot of them love being educated about exactly what's going on because they can understand it better. I've had patients that be like, "Wow, you're really talking about it. I didn't know all this stuff." And they'll have a wound for like 2 years, and I'm like, "Oh, I guess like they never really explained it to you because people are more willing to be more compliant if they understand why they're doing what they're doing, why they have to be offloaded, why they have to take this like why they have to go to vascular. They will understand, but you can't just say go to vascular where it is. You have to explain to them exactly why they're doing it and what will be the outcome or what will be the benefit for them if they are compliant with these instructions. Okay. You have to explain and help them understand. Because it doesn't matter how many limbs you save if you like lose your integrity as well as the patient's hope and spirit in us. Okay. So this is what Al Pacino was defending in that movie, A Certain Woman. It's not just a student, it's not just a decision, it's about integrity. And integrity in medicine looks like acting early and not acting reactively, okay? Acting early, questioning normal when the patient isn't healing, okay? 2 weeks, 2 to 4 weeks, okay? Like yeah, if it's not closed and it's not 50% less, that's not normal, okay? Refusing to accept a preventable amputation options, okay? Advocating for the patient. That's integrity. Advocating for the patient, even when it's inconvenient. People are get annoyed. They think about the cost of it. They think about the tedious hours and work, and then it's a huge risk. It's a huge risk when we're doing limb salvage because the wound can turn left out of nowhere sometimes. But you still need to advocate for your patients. You got to stand up for your patients. And, some people like to take advantage of that aspect when the patient is in this horrible, vulnerable state. And I hate seeing that. And I feel like that's just pure evil. Like when you see people used to monetize it, I think that's illegal in my opinion. Okay. So like integrity in medicine is such a huge deal, but what's going on right now with the healthcare system is just prioritizing monetization of people's need to be healthy. And I don't like that. And then also integrity in medicine looks like slowing down when others are rushing past red flags, okay? Integrity is what keeps the spirit attached. So how do you protect your spirit as a clinician? Okay. So this isn't just about philosophy. We love me some philosophy. This is about survival. So, number one, how do you keep your spirit alive? Stay offended. Why do you think I get offended so easily? Not like easily offended, but I get offended if they miss something about a patient. Like, I'm like, why did you miss this? Was this on purpose? What was the purpose? Like, I'm a newbie in this. So I'm like, why was this missed? It doesn't make sense. Why didn't you ask me? It didn't make sense. So stay offended by preventable outcomes. Okay. If it stops bothering you, that's a warning sign. You're getting desensitized to people making bad routine decisions. Question routine. Routine is where there is misdiagnosis, okay? A lot of times, okay? Nothing is routine about diabetic foot, okay? Nothing is routine besides if they heal and they just come for a routine toenail clipping and callus debridement or whatever. But when there's a foot open or there's deformity and neuropathy, there's nothing routine about it. You have to stay aggressive and alert. Now, another big thing when it comes to keeping your integrity alive is document and defend your decisions. Integrity without action is just intention. Next, advocate aggressively for your patients. Advocate for vascular consults, advocate for offloading, advocate for early intervention. Okay. Stick up for your patients. Be honest, okay, about what's happening. And honestly, stand on your own 2 feet. Be able to know that what you're saying is the right thing to be said, okay? And also, one of the biggest things is remember your patients. Remember the patients that have lost their limbs, okay? Because, it's not to guilt yourself, but to stay connected to why it matters, okay? You have to remember because honestly, a lot of these decisions are dependent on the clinician's decisions, okay? As well as the patient, because it's a team effort. But, you know, when I got first into podiatry, I did not know how close it was related to life or death based on decisions based on the foot. But it actually is, no matter what. Eh, So, in closing, let's bring it back to the question. What is worse, losing a limb or losing a part of you that fights to save it? Because every day in diabetic foot care and diabetic ulcer care, we stand at that intersection, between what is right, what is easy, what is routine, and what is intentional, what is passive, and what is aggressive care. And every decision we make either preserves something or cuts something away, and not just from the patient, but from us. So when you walk into your next case, don't just ask, what's wrong with this foot? Ask, what am I willing to overlook today? And it should be nothing. You should never overlook anything because the answer is that's where the real risk is, okay? Don't ever overlook anything when it comes to a diabetic foot. And this is Diabetic Foot Files, where we don't just save limbs, we protect what makes the fight worth it. And I'll see you next time. And this is Dr. G, and take care of your feet because they take care of you.